Hey everyone, I just wanted to drop a couple of notes about this episode before we get started. Of course, this episode is special to me because it's my sisters and my mother and sister-in-law all talking about our experiences with birth, transitioning from hospital birth to birth at home and kind of our culture and community together. So I hope that you all enjoy it. Because we have so many people on the line, you are going to hear that the audio is a little bit more rough than usual. There are some jumps in some places because we had never had 6 people come on to be interviewed through Riverside before. So it's been an adventure editing and putting that all together for you. I also wanted to make a note that hopefully this is a helpful episode for you, regardless of your ideology, religion, thoughts about birth, and place you are in life, whether or not you've already had all your kids or whether you are just starting this journey and maybe you haven't had any kids at all. This is meant to be helpful for everyone and to give lots of different perspectives. As you'll hear throughout the episode, my family comes from more of a traditional Christian background, and that is really important in their birth experiences. But this is not meant to take away from anyone else's ideology. This can apply to you no matter your spiritual background or thoughts. So I hope you really enjoy the episode, and I will see you in the next one. Okay, enjoy the show.
Welcome to the Feminine Alchemy podcast, where we explore the truth about the feminine, the peaceful, the wild, and the visceral. I'm your host, J.N. Behringer, joined by my co-hosts, Julie Dean Richards and Kaylee Rose. Each week, we explore the deep mysteries of the feminine and help listeners apply them to their daily lives in a practical way. Join us to unlock the hidden wisdoms your soul has been waiting for.
Hello, everyone, and welcome back to another episode of Feminine Alchemy. I am Julie Dean Richards, and today we have a super, super special and close to my heart episode. I actually have brought on my sisters and my sister-in-law to come talk about our family's culture around birth, particularly around home birth, how we connect to each other as a community. I think this is something that a lot of women have been longing for. They would love to have this support, especially during this passage of birth and as we help each other grow together. And I wanted to have that kind of on display with our family because this is a question I get asked a lot when people find out that I have done unassisted births. They ask many times, how do you do that? How does your family feel about that? How does your family feel about this kind of work? And so I was like, well, why don't I just bring on my family and we'll talk about it, because I'm about to birth another baby in just a little while. We're going to do this kind of as a panel style because for the first time in Feminine Alchemy history, we have 6 people on the line with us. So what I will do is I will introduce my family one by one, and you'll be able to hear their voices. You'll be able to get to know them a little bit. I'll ask them questions in this panel style. And then just so you know, this is real life here. Some of us have little babies. Some of us have stuff we got to run to. So some of us will be popping in and out throughout the interview, and I'll let you know if someone leaves, but we're just going to get started. I can't wait for you to meet my family. I'm also a little nervous because who knows what they could say about us, but we're pretty much an open book here. So I'm going to start with my mother. My mother's name is Bonnie, and Bonnie is the matriarch of our family, and she's the head midwife in our birthing community. She goes to almost every birth that happens, and she has been my inspiration for much of my life. She's a super hard worker, and she's also held our family together. So, Mom, why don't you just tell us a little bit about yourself?
Okay. So, yes, I am the reason that this is happening. I am the mom. I have 8 children I've raised. I gave birth to 7 of those children. I was a critical care nurse for 5 years, and that definitely helped me in raising my children. with those skills. And I just wish I would have known more about home birthing when I was having children, because I would have probably done exactly what my daughters are doing. But I'm really grateful that I'm able to assist them.
That's great. And also, Mom, how long have you been a nurse now?
Oh, over 40 years.
Yeah, so my mom is still a registered nurse and she has a really cool job. Do you want to tell people what you do?
Do expert witness work for legal practices, and I review medical billing and medical records and testify to reasonable value of medical records.
So there you go. We've got the legal and the medical going. My mom is the reason we're all here. Something she didn't mention is she actually has pretty much raised 11 children because she has 3 of our nieces at home with her who've lived with her most of her life. Many of you know that my sister passed away a few years ago, and my mom has always been the stronghold for them as well. So she's still raising kids even now. So we'll go in age order. So we'll go Natalie next. So then we'll go to my oldest sister, Natalie.
I'm Natalie Brostrom. I have 6 kids, had 3 in the hospital with epidurals and lots of interventions, and I had 3 at home. Actually, all 3 were technically unassisted, although I did have a midwife with the first that I had at home.
Well, something kind of fun about Natalie, I was going to say, because we talk about astrology on the podcast, is that right now you can't tell because my voice is raspy and I'm kind of sick. But growing up, people always comment on how Natalie and my voice sound really similar. And the funny thing about that is that we have Mercury in almost the exact same place in our birth charts. So our voices and the way we talk is really similar. People always comment on that about us. Something else about Natalie is she is an incredible researcher. Since college, she's been into nutrition, and she's like our designer. Her and Cassidy do a lot of the designing in our family, as in like they're really good at creating beautiful spaces, making things gorgeous. Like the way she designed her house was really beautiful.
Thanks, Jules. I also think I was kind of the pioneer in terms of holistic living and going down that path because I had some health issues and the doctor wasn't helping. The things that they were prescribing weren't helping. I had a lot of issues with depression and anxiety and strange issues like symptoms of multiple sclerosis. And I had to do a lot of research and figure out why those things were happening and why the pills weren't working. I got into more holistic living, diet, exercise, nutrition, all of those things. And then I started sharing that with my sisters, and Julie was one of them. So I think I sort of was the catalyst, but everyone else has taken over and they're all doing their own thing now. So I love that.
Yeah, I was going to get into that a little more in our questions, but Natalie is the sister for people listening who've been longtime listeners. She's the sister I often talk about when I talk about my evolution with health, her sending me studies and helping me to kind of direct myself in my path of research and kind of being disillusioned with that. So that's Natalie. She's also the Leo Taurus that we always talk about. She's our Queen Leo and Taurus moon and our Sagittarius risings. And then we've got Emily, who will be next, my sister Emily. Emily is also a nurse, but she is the sister just older than I am. Go ahead, Emily. Introduce yourself.
Hi, I'm Emily. And like Julie said, I am the one just older than her. I'm number 4 out of the 8. And as she said, I am a nurse. I have been a nurse now for, it's 2025. 15 years now, which is crazy to think about. And I started my nursing in home health and hospice. I did that for about 5 years. And then I did about another 4 years in med-surg medicine, medical surgical, where you either get the people that are too sick to go home but not sick enough to be in the ICU, or they came out of surgery and they got to stay with us a little while before they can go home. And then the rest of my nursing career has been mom and baby. So I worked on postpartum and I worked in the nursery. And then the last 2 or 3 years, I also did labor and delivery. And my holistic journey pretty much started because of my sisters and kind of like really went into gear during COVID because I was really disillusioned by everything at that time. And also just seeing a lot of the things that were happening in the hospital to my patients, people being pressured into situations that probably were unnecessary, especially when it came to like C-sections, seeing women that had perfectly normal blood pressures put into C-sections because they had one high blood pressure out of their whole pregnancy, etc. I have 4 children and I live on a farm, 15 acres, and I am an amateur homesteader with 2 dogs and 38 chickens and a garden that I am still learning how to take care of.
Yeah, she says she's an amateur, but she's definitely a master compared to me, that's for sure. But she is really great at canning. She makes this like delicious fermented salsa that she does each year. She made a soap before by hand, which is still some of the things that I carry around, that soap, and I've used it my whole journey this past year traveling around America. I use Emily's soap. And she is really great at what she does. She's our manifester. So for people listening, Natalie, who talked before her, is a manifesting generator. My mom is a generator. Emily is our manifester. She's also a Pisces sun, an Aries moon, and she's a Cancer rising. So she's got that water fire going on for her. So thank you, Em. I guess by age order, we should go to Cassidy next. She's our sister-in-law. She married my younger brother, Michael, and she has just like been such a bright spot in our family, has always been someone we welcome with open arms. We just love her. And she also, like I said about Natalie, the design. She's very good at like design and spaces and beautiful things. And she's also very into nutrition. So I'll let you introduce yourself, Cass.
Thanks, Julie. That was so nice. Yeah, I am Cassidy. I feel like I married into the best family and got the best in-laws. I don't feel like they're my sisters and just my mother-in-law, but my friends. So I feel like I lucked out to the max. But like Julie said, I'm super passionate about, nutrition and health and breastfeeding, especially. I have 2 kids. So I have a 4-year-old and a 7-year-old, and we went through a lot of breastfeeding issues at first. And so I feel like I had to dive deep into the breastfeeding hole and oral tie stuff and all of that. So I'm very passionate about that. Like Julie said, I love design and spaces and organizing in my free time if I can get a spare moment.
Cass is super smart. She has always, like she said, she's been into health and nutrition, but she wrote a whole paper about MTHFR and did a bunch of research on that and how it affects oral ties and just her experience. I always, when people are like, I need help with lactation stuff, with like breastfeeding stuff, I'm like, Cassidy will have all the resources. She knows all the stuff. She's been working in that sphere, so very knowledgeable in that space. Cassidy is also a Capricorn with an Aries moon, and she's an Aquarius rising, and she's also a generator. So she's so much fun to have. Then we have Kalista. So Kalista is technically our niece, but she's really our sister. She is my oldest sister's oldest daughter. So she's only 5 years younger than I am. We actually got the opportunity to room together at college for 1 semester before I graduated. She has been one of my best friends, and Kalista has been on the podcast before. We've loved having her. And go check out that episode. It's called Real Raw Self-Care. She was amazing, and I'm so excited to have her back. Go ahead, Kalista, introduce yourself.
I'm Kalista. I am so happy to be here with my family. I am a mother of 2 young children. I have a 4-year-old and a 2-year-old. I am also a birth doula. And I would say that my experiences with my family, my sisters, they really shaped that work and that desire to do that work, and kind of what's become to me a calling in my life. And that would not have been possible without all of their experience. And I just feel so blessed that each of them brings a beautiful piece of the puzzle when it comes to women's health and birth and just all the things that support our bodies and our babies. And I'm so excited for us to be here and talk about all the things.
Thank you, Kalista. Kalista is a Libra with a Gemini moon, and she's also a Sagittarius rising. Also beautiful. She's a generator, and she is an amazing doula. I've only heard positive experiences with her, and I've been lucky enough to be at both of her births and to see just like she's amazing at what she does and her birthing process. So I'm so grateful all of you are here. So let's get into some of these questions. And what we'll do is we'll kind of go in that same order. We'll just go from the order from oldest to youngest. So from my mom to Kalista, and asking these questions. I might direct a few directly to them. But one that I had for my mom specifically was during this evolution, you had been a nurse, you had many births yourself, 7 kids in the hospital, had worked through lots of different nursing, had been to a lot of your daughter's births before all of this. So what do you think it was that like really helped change the way that you saw birth? Because I know Michelle, my oldest sister, had a lot of complications. And do you think differently about that now than you thought about it at the time? And just what was that evolution like for you, Bonnie?
Well, the evolution was really magnified by COVID, obviously. So Natalie was pregnant with her 4th child, and it was during COVID. So she had opted to have a midwife. And so I came out to be with her, to help her, like I do most of my daughters and most of the births. I always try to be there for everyone's birth, but I've only been there for one of Emily's births. She's always way early, has her kids way early. I never make it on time, but I did the last one. So during that period when COVID was going on, and that's when I could really see the medical capture of what had happened, and really knew that there was, I mean, I always knew this because I stopped going to a doctor after I had my last child. After I had my last child, I never, ever went back in for my 6-week checkup. I've never had a pap smear or a mammogram or anything after that because I was like, no, there is something wrong with this. This is not the way it should be. And so I had already decided that these things, that this whole, some of this medical prevention was not real. And especially when I started getting into medical billing, I realized what a travesty it was that they're billing everybody for all these things and making everybody do all these unnecessary tests and just to rack up the medical billing. But when Natalie had her midwife didn't come in time. And so I ended up having to receive the baby when she delivered. And I realized that was like the greatest way to have a baby. And also it just changed my whole perspective on birth. I knew at that moment that birth was supposed to be natural like this, and that it wasn't supposed to be done in a hospital. It needed to be at home. It needed to be, a birth. But also, even before COVID, when Julie had her first home birth, she had her 2nd child at home, and she had a midwife. That really started opening up my eyes to home birth, and I was like totally sold on it from Julie's also. And that was really the thing that opened it up. But then when COVID came, it was like, no, everyone needs to have their babies at home.
Yeah, I love that. And I've loved kind of seeing that evolution, and that you have kind of the expertise of seeing like what's going on in the medical billing realm. And I wanted to ask, it's okay, Nat, if you're not able to answer right now with Nat's nursing her baby as we're chatting. But I would love to hear that experience from your point of view of like the difference between having 3 births in the hospital versus 3 births at home. And then that first birth with your 4th child, because it was kind of a surprise. The midwife was there. Do you want to talk about that a little bit?
It was night and day difference for me. I knew after I had my 3rd that I wanted to have my 4th at home. I didn't know the circumstances, obviously, that I would be birthing into when we finally were ready to have another baby. But my first 3 in the hospital were all my first birth was traumatic. There were lots of interventions. I had some early labor and she was posterior. And so it was just a really long labor, and I ended up with Pitocin, and then I ended up with an epidural. I ended up being on Pitocin for more than 24 hours. I ended up with multiple midwives because I've always been under the care of a midwife, but it was always a hospital midwife. Some people like to call them medwives, and they were caring people, but I felt out of control a lot of the time when I was in the hospital. There was a lot of things happening that they just wouldn't even talk to me about. They would just tell me what they were going to do next. So after my first birth, where I had a 3rd-degree tear, and before she was born, they brought in the C-section team. They told me if she didn't come out this time, they'd section me. And it was just, they were ready for a blue baby and all of these problems. But she came out great. I just ended up with a lot of issues. I hemorrhaged really badly, of course, because I was on Pitocin for so long. I had horrible reaction to the epidural. My BP dropped to like 70/30. I was vomiting, which can be normal in birth, of course, but it was specifically from the epidural. And after that experience, I just wanted for my second birth, I just wanted to make it through. Like, I just wanted to just survive a birth without feeling so traumatized, I guess would be the right word for it. I just wanted it to be uncomplicated. So for my second birth, thankfully, it really was uncomplicated, but I still have those problems with the epidural. With my third, it was similar, but longer. And afterward, I was just like, I can't be having my babies in a hospital anymore. I need to have my baby at home. I can't have epidurals anymore. My body does not like this. And I always felt so dazed. Like, I couldn't remember when my baby came out how I felt. I sort of felt numb. I wasn't experiencing these things that I had heard other women experience after giving birth. And it's okay to honor everyone's birth experience, and not everyone is going to feel euphoria or all of those things after giving birth, and that's okay. But I knew that there was something better, and I knew that I wanted something better. It was before COVID. I was pregnant in 2019. I found a home birth midwife. She was fantastic. I really, to this day, love and respect her. But I had had such long, prolonged labors up until that point that when we called her saying that I was in labor and it was strong and I couldn't speak through contractions and they were every 3-ish minutes, she was just getting off of a delivery. And so she just told me to lay down on my left side and to call back when things changed. Well, I laid down on my left side, and 3 contractions later, I was in transition. And that baby came about 20 minutes afterward. And so it was very intense. It was a 2.5-hour labor, less than 2.5 hours, very precipitous, and just completely night and day difference from the 3 I had in the hospital. And it was incredible. I didn't know exactly what to expect, and I didn't realize I was in transition. Thankfully, my mom was there. Thankfully, she was, even though she kept wanting to check me and do all of these things that I wasn't sure about, she was the perfect person to be there for me because she knew all of the signs of transition, and she knew all of the signs that this baby was coming immediately. So that was such a blessing. And then as soon as she came out, it was like, oh, this is how I'm supposed to feel. Like, this was right. This is what a whirlwind, but what a blessing, and how overwhelming, but at the same time glorious and incredible and empowering. And so I loved it so, so much. And my midwife showed up about 45 minutes later, and she was great. And, we delivered the placenta. Everything was, it turned out the way it should.
So you've had 2 unassisted births since then.
Right.
after that. And technically that was an unassisted. So for people listening who don't know, an unassisted birth just means you have no medical professionals, like you're not under the care of a midwife or something like that when you give birth. So I wanted to lock in on something you said about the way I'm supposed to feel. Like this is the way it's supposed to feel. For women who don't know what that way is, what is the way you're supposed to feel? And not to like you said, not to shame anybody's experience. If you don't feel like this, like Natalie described, she didn't feel like it either at many of her births. But what is that way? And what about the next two? You don't necessarily have to tell us their birth story, but did you feel that way each time you've done it unassisted?
Yeah. I would say that I did feel that way with my next two as well. But each birth story is different. And in terms of like how I'm supposed to feel, I think that each woman can know that within herself because um I don't think that I could put into words how women are supposed to feel, but just that I knew I was supposed to feel empowered. I was supposed to feel relief and joy and excitement and just so much gratitude. Those were the feelings that enveloped um, inside of me and outside of me. So my other two, my fifth was a 5-hour labor, and my mom and Julie, they were both there, and it was, I think, honestly, probably my favorite birth, if we are allowed to have favorites. I felt so supported and loved, and just everything happened in a cascade of ways that I just love. It just felt like it progressed the way it should. It felt not too fast, not too slow. It all came the way that it should. And obviously my husband was there too. I forgot to mention, but he was always there and he was a huge support. So I don't want to minimize that. So I loved that. And for my last birth, it was very different from my others. It was a 12+ hour labor. Felt supported. I felt all those things. She just needed more time to come out, and I'm not sure if I was maybe in the right headspace or not. She was later than my others, and I think I was sort of in a bit of disbelief that it was happening, but gratitude. And also, I was just exhausted because I had had some prodromal labor for days before, too. So I would be up all night laboring and they would stop in the morning. And so I just didn't get a lot of sleep. But at the same time, everything felt like it progressed the way that it needed to. And she was born the way she needed to be born. So I am very grateful for that. And I just think that it was a nice end cap to my other births, something I could really experience that took quite a while, but it was a beautiful, I think, closure to my birthing experience.
I didn't want to put you on the spot with saying like how women are supposed to feel. I'm just saying that that's many times, and I think I was thinking about how many times we have experiences that don't feel right to us in birth, and we don't know why, and we just don't know, well, what could birth feel like? I guess I should have said, what could birth feel like? Or we know that's not the way that we personally are supposed to feel during birth. And so it's good to be able to put perspective on, you can have it both ways. It's okay if you've had these experiences in birth, and it's possible for you to have new experiences and feel new different ways, even if the births are different. So I think you did a really good job explaining that and showing how every birth is so unique and beautiful in its own right as well.
Thank you. You summed it up perfectly. Thank you.
So the question I wanted to ask Emily, though, was you have had births without epidurals in the hospital. So I wanted to ask you about that experience versus your home birth experience with your last baby, and how that differed for you, and what was it like doing a birth in the hospital, without an epidural, without interventions. How did you feel about that? And for women who do it, do you have any advice?
So yes, I did have 2 of my births in the hospital unassisted by medicine. And, the first time I did it was pretty amazing. It really kind of is what got me into the door of possibly doing it at home in the future. So when it comes to birthing without assistance in the hospital, something that you have to definitely do is make yourself very clear to the staff and to your doctor, and talk to your doctor or your midwife or whoever before and say, hey, I am going to be doing this without an epidural. I don't want Pitocin. I don't want this. I don't want that. You need to make those very clear. And you have to have a partner or a doula that's going to be there to support you in that decision. Because to be honest, as nurses, we have a way that we like to do things. And sometimes it can be really hard not to do the things the way we want to do them. For example, when I was working in the hospital, I don't care. I'm a nurse that tries to do whatever the patient wants. That's just the way I feel about it, because I've been a patient at both having a baby and not having a baby. I've been in the emergency room before, had to have emergency surgery, and just seeing how those different nurses treated me really influenced it, the way that I wanted to treat my patients. And so I was like, okay, well, I'm going to do what they want me to do. But anyway, I worked in labor and delivery, and I had a nurse who sat next to me. She's like, this patient wants to do this natural. I hate working with these patients because they scream and I just want to make them feel better, and they get uncomfortable with it. And so what you have to just be very, very strong with what you want to do. And you have to, know that people might want to push you the other direction because they're uncomfortable with it. They're uncomfortable with it. They're uncomfortable with seeing people in pain or uncomfortable. We're in a culture where where comfort is epitomized. Oh, you can't let your kid fall and scrape their knee. Oh, that's terrible. You're a terrible parent if your child gets hurt in any way. Or you're a terrible nurse if your patient's in pain. You have family members that scream at you as a nurse if their family members in pain and you couldn't get there right on time to give them a pain med. Discomfort is uncomfortable to watch. And so for me, I chose the route when I was birthing to use hypnobirthing, which a big part of that is just taking the pain word, making that a bad word, and it's out of there. You even have to tell the nurses, you can't ask me on a scale of 1 to 10 what my pain is. You can ask me about my pressure. Is my pressure stronger? That kind of thing. That's really important to be in that mind space. And that was really helpful for me when I was in the hospital, just training ahead of time. When I knew I didn't want to use medication to help me through birth, I had to train myself ahead of time out of the cultural thought process that birth was painful, and instead be like, this is natural. There may be pressure. This is a time of relaxation. It's not a time of clenching and fighting and that kind of thing. It's a time to let my body do what it's going to do and just let pressure roll over me and not think of it as pain. So that was extremely useful when I went to the hospital, and just making sure that the staff knew and that my doctor knew exactly what I wanted. And once they knew that, and they were great. I had a great doctor. He was awesome. When I told him what I was doing, he's like, yeah, that's awesome. I have a dad. He uses hypnosis in his practice and stuff, and it does great things. So that really helped too, that I already had that behind my back. And the whole experience was wonderful. I had a very supportive doula. It ended up being a wonderful experience for me because I had excellent support from my husband and my doula and my staff. I happened to work at the hospital that I did this at, and they all knew what I wanted to do, and they were all very respectful of me as a colleague. But home birth, in comparison with home birth, I would say that my home birth was actually my favorite because it was just so calm and peaceful and quiet. I didn't have nurses coming in to check my blood pressure every 30 minutes. I could actually sleep afterwards and enjoy my baby. And during labor, I got to eat and drink whatever I wanted. It was very much like, this is completely normal. It's just a normal day. I'm just having a baby today. And I have to say, the recovery was awesome. It was nice not to be constantly monitored every single second. Whereas in the hospital, it's just something you have to expect. The nurses, like, they have responsibilities to make sure, because once you're in the hospital, you are under their care. They have to make sure that you're doing well. Because if for whatever reason you hemorrhage or something bad happens to you, they have to be able to show that they've done all their due diligence, so that way the hospital doesn't get super sued or they don't lose their license, etc. And so if you're going to have a baby in the hospital, you got to be understanding that to that as a point. You could always tell the nursing staff, hey, I really want to sleep. Can you just put patient denies vital signs during the night? Because they can't make you do that. But if you tell them just chart that I deny vital signs through the night, then their butts are covered, because then they can say patient has denied vital signs despite education or whatever. And then they won't care. They just will leave you alone. So is there anything else, Julie?
Great tips. I think that's really beautiful to hear, and to hear for people who are like, well, I have to have my baby in the hospital, or I need to, or I need these, interventions, to hear like you can still have a beautiful birth in the hospital as well. And you have those choices. So it's really cool to hear that experience. Cassidy, I wanted to ask you about, like, you did home birth from the beginning. You and Kalista are the only two who started not doing a hospital birth. And also you had married into this kind of crazy family that had these crazy ideas about birth and holistic living and all of those kinds of things. And so how did that affect you, your decisions, and what was it like to birth from the beginning? Like, was it scary to do a home birth from the start? What was that like for you?
Yeah, that's a great question. So I will say I've always kind of had this inner desire to follow natural medicine in a way. Like when Michael and I got married, I was really into essential oils and always loved yoga, things like that, that were more grounding to me. And he would always say, you are going to be one of those people, right? And I would be like, no, I'm not. And then of course I got married, and I feel like once I started having kids, I started chatting with more of my sister-in-laws about birth and those options. And I also had a friend growing up who actually had a home birth, and she would always talk about a friend's mom, growing up, who had a home birth for one of her younger siblings. And that was always really intriguing to me. And so I thought that could be an option. And once I got pregnant, I just could not picture being in a hospital. I couldn't picture being checked all the time, kind of like what Emily was talking about. And I just pictured a really peaceful, serene experience. And knowing that, Julie, you had just had a home birth you were talking to me. Natalie had just had a home birth, and Julie had told me about her experience, and kind of wishing that you had had a different experience from the hospital. I think I remember that. It just made me think that home birth was the route. And I was a little nervous, to your question of being nervous about birthing out, like first time at home. I lived really close to a hospital, so I felt like that was a comfort measure. If something went wrong, I could get there in 5 minutes. It wasn't a big concern of mine. And also finding the right midwife for me was really important. In my area, there were only a couple options, and so I was able to shop around. I went to a birthing center that didn't really feel right. I actually signed up with them and then ended up switching after finding my midwife, which I was so grateful for. And once I found her, everything just kind of felt like it fell into place. But birthing at home, I feel like the first time, I just didn't really know what to experience. I was very nervous. I remember getting a blessing from my husband, even just being nervous about what to expect, being able to manage the pain, knowing that if I was at home, I had to be at home. Once I went into transition, I couldn't get an epidural. You just really have to prepare your mind, I feel like. And I really felt like with my second, everything went smoothly with my first birth. I had a 7-hour labor. I get very in the zone and was able to focus. I felt like I had a good support system. Natalie was my doula for that birth. And she was really helpful and grounding, and my husband too. But for my second, I just felt like I knew what to expect more. And I felt like I could prepare my mind for that mental game, kind of like what Emily was saying, with not allowing myself to think about the pain, but the pressure or how everything was pushing me forward. And so I don't know if that answers your question, but I just feel like, for me, I just felt like home birth was the way from the beginning, if that makes any sense.
No, I love that. That's exactly what I wanted to ask you about, because for other people outside, they're like, oh, you're not even related to these people. I mean, you are by marriage, obviously you are our sister, but it's different coming into kind of this culture. We have actually known Cassidy for a long time because Michael and Cassidy grew up together, but you had come into the family kind of during the transition period when we were transitioning from hospital birth to home birthing. And so you kind of got to see what that looked like. And I just think it's interesting to hear your perspective on that. It was natural for you, and so much so that you felt comfortable having Natalie there to doula for you. I think like says a lot about the community of our family. How has that been for you to be in this kind of community with us and see the transition from more of an outside perspective?
Yeah, I feel like it has been so amazing. I will say Bonnie was at my second birth too, and that was just grounding. I feel like having someone in this family helps you to feel more comfortable and know that you have a support system. Like everyone has said, Bonnie is so knowledgeable about birth, and I felt like she was the right person to be there for my second. And I will say, I forgot to mention, I'm adopted. My mom couldn't birth or have children. And so that was another thing. I feel like I never really had this perception of how birth was supposed to be. It wasn't something that was talked about. I didn't see my mom birthing or nursing growing up. And so I don't feel like I had this preconceived notion of what was supposed to happen, aside from like births in movies, which I know is so unrealistic. And so I feel like in a way that helped me to be open-minded to what could be and to follow my own intuition and what was necessary for my births. But yeah, I just feel like having sisters to talk to. We have a girls chat. I feel like we always ask questions, and I feel like I have a really safe space where I can ask opinions and then also make educated decisions myself and have that support on both sides.
Thank you. Kalista, my question for you is, so you've done 2 home births. You did one with a midwife, one unassisted, but you also are a doula. And you've been able to see other people in the way that they birth and help them with those decisions. And how has that influenced you personally? I think most women are like, well, I'll try it in the hospital first and see if anything happens, and then I'll do a home birth. But the two of you kind of jumped in that way. And so what has that been like for you? And what is it like being a doula and helping other women with this process, mostly in the hospital?
I would say I was nervous a bit to, like, just in general for the experience, right? But I had this strong conviction that I needed to do this at home, and I actually felt safer doing it at home. Because for me, so as we talked about earlier, my mom is the oldest of my grandma who's here, Bonnie's children. She, I would say, had the most complications in her births out of any of the girls in our family. And after talking with her, to me, it seemed very hospital induced. Like the interventions that they were doing caused problems. And we have a genetic health condition in our family, but we didn't know about it at that time till my last sister was born. And we have special doctors that we go see and everything. And one of the things that they had told me was, you need to birth here because you're considered high risk, and we don't want you getting an epidural. We don't know if you have AVMs in your spine, so you need to come here. And that hospital is 2 or 2.5 hours from where I live. And so just doing my own research and also the experiences of my aunts / sisters really I felt safer at home because I knew that people weren't going to push things on me. I trusted my body. But because I had this, I actually had a lot of pushback from midwives even. I was denied by 2 midwives before I found the midwife that we used for my daughter's birth, my first child. And I had people tell me when they would ask what hospital I was going to give birth at and all these things, and I would mention I'm going to have a home birth, and they'd say, oh my gosh, that is crazy. Are you sure you want to do this for your first birth? And it's so painful. It's the worst pain you'll feel in your life. And so those things were unsettling, but I really believe God helped me to just have this conviction where normally I'm kind of anxious and fearful, but I did have that conviction to do this. And I had a really beautiful experience with my daughter. My labor actually lasted 24 hours from my first contraction to when she was born. I was in active labor for 4 of those hours. It was very long and spaced out, which actually for me was really perfect because I didn't feel overwhelmed easily. I did not feel like it was the worst pain in my life. It felt very manageable, very doable. And my grandma and Julie were there for that birth, and that was a huge comfort. I would say support that you have or don't have will make or break your birth. There's a level of preparation that you can do for your birth and that I recommend because it really is a mental game. But having somebody there that you feel comfortable with is so important because in the moments where you doubt yourself or fear creeps in, because it naturally will, you have somebody that you trust, whether that's a doula, whether that's a family member who can be kind of that voice of comfort, of safety, of reassurance, and somebody who will also push you. In my births, things are like very intense. I go very inward, and it's really hard for me to get outside of that. It's very hard for me to move around. But having the support there really kind of helps me to anchor myself and be like, okay, we've got to try this different thing. So because of that experience in my first birth and really the things that I learned about like what my body is capable of and that you don't need to fear this process, that was the whole reason that I got into this work, because I wanted to change women's views of what their body could do and show your body is not against you. This is a normal and a natural event, and you don't have to fear this. You know, I want to take the stigma of fear out of birth so that women can reclaim their power in their birth and see this other side of what birthing, you know, what God designed our bodies to do. And everybody has different experiences. Obviously, I understand there is a place for the medical field in birth and everything like that. But the way that we use preventative care has really hurt women. And I've seen that time and time again in the hospital. I've actually only attended hospital births so far. I'm trying to reach out and be able to attend a home birth as a doula. But I would say in the hospital, all three ones that I have been to most recently, I've like done virtual support and I've done some in person. The in person one of the women, they all had goals to birth without epidurals or pain meds or anything like that, and only one of them had done it. And I know for one of the other women, she mentioned, like, I wish I would have called you earlier because I probably could have done it without an epidural if you had come earlier. And so I just say that because, again, to kind of reiterate, like, what support can do for you if you are going to choose, especially a hospital birth. Hospital births that I've been, I've actually been fairly impressed with the staff. I feel like they have respected women's wishes and not put too much pushback on them. But there have been times even in those births where I've had the medical personnel look at me and give me a look, and I knew that they wanted me to encourage the woman that I was working with to conform to what they were saying. And so, you know, that is something that, like, I really pride myself on, is that I'm not there to make a woman conform to what is going to be easier for the staff or what they think she should do, but, you know, being there to be an advocate and to support not only the mother, but also the husband, right? The partner that's there, and showing him how to best support the mother. Oh, the other thing I would say, you know, the biggest thing I've noticed about having a baby at home and women having their babies in the hospital is just how much more hands-off it is. And I really appreciate that, especially when it comes to pushing or like the baby coming out. Because every birth that I have been to in the hospital, they have they have their hands on that baby as that baby is coming out, and they are pulling that baby out. And every time, it is the most discouraging thing that I see. It upsets me so much. It is always the thing that I take home and I feel sad about, because that baby will come and it's just that same thing of like seeing how this natural thing is being messed with, but these hands are being put somewhere where they don't need to be. And you know, women oftentimes, they feel so relieved and are like elated, and I've seen it time and time again. They are like thanking their nurses so much and the doctors so much for being there and for doing this for them. And I'm like, in my head, I'm like, no, you did that. You know, this is not something. They were there, and yes, you know, they may have been helpful, and it's not wrong to be appreciative, right? But it is the savior complex, and I see it time and time again. And this is where I am such a strong advocate for home birth, if, you know, the circumstances are right for you, because you are reclaiming your power. You are not giving your power to someone else. And birth is not this powerless event that we've made it out.
Thank you. I think everybody is nodding, all the sisters, because I think we all feel the same way about it. Thank you so much for sharing your powerful stories with us. What I would like to talk about, because there's so many things we could talk about in this interview. There's so many things I want to ask all of you about, but there are a few things that people talk about when it comes to birth, and Kalista mentioned some of them that I wanted to get your take on. One of them we mentioned before is this factor of pain, but the one I want to hit on first is interventions, and just the idea of isn't it dangerous or less safe to have babies at home? You know, many of the objections that people have, there's a lot of fear around what ifs, right? What if something goes wrong, especially if you are doing a birth unassisted without a midwife or another provider there. So let's talk about that. I'm going to give each of you a chance to talk about it, and we'll just go in a row. So for Mom, you have seen multiple births. You've done births in the hospital yourself. You've seen your daughters give births in the hospital. You've seen daughters with complications give births in the hospital, and you've seen them at home. So what is your take about dangers, interventions, all of those kinds of things?
First, I would say my own birthing history, I had all of these girls naturally with no medications. And that's probably why they want to have their babies at home. And then I had 3 sons with just an epidural at the very end. So I had like a dose of medicine given to me, but I was already complete and ready to push. And so I didn't have like a real epidural. I labored through it, and then they wouldn't let me have an epidural because I was so far along. They'd get the epidural in, and then they go, "Oh no, you're complete. We can't hook you up to this line for epidural. You know, you're having your baby," or whatever. So I want to say that I think a lot of the things that you fear are all brought on by the medical community and the protocols of the medical community. Because the thing that I hated the worst was that when they get you in there, they are treating you like a sick patient, and you are not a sick patient. You do not have to wear a belt and have your baby's heartbeat monitored and monitored and monitored, or have these things happening that they're doing. They keep monitoring because they think that something's going to happen if the baby's heart decelerates and all these kind of things. And I have seen time and time again where they are positive that there's a problem with that child because of deceleration. And then there is nothing wrong with the child, and there is nothing wrong with the baby's birth. And I think it's the fear that interferes. Once they start telling you, "Oh, your baby's heart rate's slowing," or whatever, then you get fearful, and then your body reacts. So I really think that the point of the matter is when you have your baby at home, you don't worry about all those kind of things. You don't have monitors on. You're not checking the heart rate. You don't need to check the heart rate. As long as you are feeling normal, as long as you know that you're doing well, as long as you know that baby is moving still, as long as you your labor is progressing and feeling good, then you're doing what your natural body is doing. And there's a lot to do with your actual delivery where people have thought that you had to be in a certain position, that you had to push at a certain time. All those things are wrong. All those things I've noticed and found out that these things are wrong to be teaching these women and to making them think that this is going to help the outcome of their birth. And I know for a fact that I could have had my babies a lot faster if I would have just done my instincts and stayed in the position I thought I was supposed to labor in and been able to push the baby out when I felt it instead of them saying, oh, the doctor's not here yet. Don't push, don't do this, don't do whatever. Everything we've learned over the years in medicine and everything like that, you have to be able to question it and you have to be able to look at new things. And I think that the medical community has done us a disservice in the field of obstetrics because they will not look at the new data. They will not do the correct studies. They will not look at the outcomes of home birth. They will not take this into consideration and see that they don't need to do all these things, and part of that's because a lot of things they do, they get a lot of money for, so they want to do that. That's my opinion on these interventions. And the other thing is, if you say you're in pain, they're not going to try to position you. They're not going to try to help you focus. They're going to want to give you meds. And that's the other thing. That's your pharmaceutical capture that we're looking at right there.
With a follow-up to that, because Michelle did have several complications, do you view those differently now with what happened to her? Like, I know she had a seizure after, was it Kalista or Logan? One of the two, and had some issues. What do you think about those interventions? Because some of them, what people would say were like pretty serious.
With her first baby with Kalista, I think that, part of it was that she had HHT. Nobody knew that. Nobody knew her complications or knew what was going on. Because if they had, then they could have prevented some of these things that have happened to her. So I think it was just bad hospital care in general, why she ended up doing what she did. However, I don't know that I think they were treating her seizure as a seizure. It was actually a seizure because of electrolyte imbalance is what I believe. And they didn't see it that way. And so, of course, they put her in the ICU and they did all their medical things because they didn't understand that. With her fourth child, she had gotten an epidural and they had nicked her epidural and she had bled into that space and had to have a patch done because, she was leaking spinal fluid. And so that's bad medical care. A lot of these things could have been prevented if she had been prepared and trained for a home birth.
That's good to know. All right. So we'll just go, Natalie, Emily, Cassidy, Kalista, and you can tell us your thoughts about, isn't home birth dangerous? Interventions? How do you deal with that? Things like that.
So I just wanted to jump on, comment also on a couple things that mom was saying. I think with our oldest sister, another part to consider for her, it was also lifestyle factors and her health history and her lifestyle choices leading up and during pregnancy. They can have huge impacts on how labor goes. And I think that wasn't something that anyone considered or that she knew to take, I think, a little more seriously. So I think that made a difference for her as well. But in terms of what happens for complications or interventions, the vast majority of things that could go, quote unquote, wrong during birth, I think are manageable at home with proper education. And that's how it was designed to be. I think we forget that God created us to birth. We were made to carry these babies. Our bodies know exactly what to do, and that we are made to have successful labor and deliveries. We're made to have successful births of our babies. We would not ever make it as a species if we were designed to fail at birth. And so our bodies are designed to protect our babies, to grow our babies, to make sure they're the perfect size. So many interventions are done because of third trimester ultrasounds and concerns about sizing. Oh, the baby's too big, the baby's too small. No, the baby is exactly the size the baby's meant to be. You will be able to have that baby just the way that you are supposed to have him or her. So I think those things are worries or concerns that are put into our head and that can affect the outcomes of our birth. I also think that if we go into birth and labor with the idea and understanding that you may feel pain, but it's pain with a purpose, right? It's not the same kind of pain that you experience when you break your leg or when you have an injury. The pain, or whatever you want to call it, it leads you to the best moments of your life. So it has a purpose to it, and it allows your body has built-in mechanisms for endorphins, for oxytocin to, if you want to say counteract or modulate those pains that you feel. And knowing the outcome, I think, makes a huge difference for how you handle the way that you're feeling during birth. In terms of like complications, I think that having a knowledge about them is important, but not allowing that knowledge to taint the way that you view what is going to happen, if that makes sense. Don't allow your knowledge to turn into fear. Because I think that's what happens most of the time in the hospital. All of these care providers, these practitioners, everything is a fear. They view everything through the lens of risk. And I think a lot of times that risk is blown out of proportion, and then they act based on it. Like we talked about before, in order to cover their bases, in order to make sure that they are able to say, well, we did everything. We did our due diligence. We covered, we did this, we did that. So the outcome isn't our fault because we did X, Y, and Z. When in reality, putting these ideas into women's heads have caused an intervention. It has caused her to react in a way that is fearful and or could make her birth outcome poor. So unless there are factors that would make your birth be dangerous, legitimately dangerous, such as preeclampsia, that is a legitimate reason to be in the hospital and to receive care and or be induced. But unless you know that there is something to fear or to be aware of, not even necessarily to fear, then I think it's best to have an optimistic point of view, because the vast majority of the time, it is an optimistic, incredible outcome. It's a happy outcome. So those are my thoughts about it. I hope that kind of answered the question.
That's perfect. Thank you, Natalie. Go ahead.
I completely agree with everything that Natalie has said and what my mom has said. Just being a nurse, we have to be taught everything that can be possibly wrong, that could possibly happen. And, that in turn can blind us to the fact that this is a healthy, natural process, and often have to be reminded that this is a natural process. And some hospitals have been really great that I've worked at. I worked at a couple of hospitals because my husband's in the military. And so I've seen lots of different cultures and lots of different hospitals. Some hospitals are really great about that, reminding the staff, hey, this is a natural process. Respect the patient's wishes unless there is something like preeclampsia or some other factors that need to be considered, but just allow them to birth whatever way they want to. And other hospitals, it's not that way. They want to treat them like a sick patient, and we need to do it this way, and this is the proper way to do it. And nurses just don't learn any other way to do it. And I think that interventions originally were put into place because of mistakes that were made in the past in the hospital. Most of the time, that is why they're there, is because somebody had died or somebody had something bad had happened. And so in order to keep that from happening again, they put what they thought would be best to keep that from happening again in place. I really think, unfortunately, a lot of times in the medical field, we get so stuck on doing it the right way that we forget that it is a natural process and that women have been doing this for hundreds and hundreds and thousands of years, and that women are capable of doing it. To speak to the thoughts on pain, a lot of the pain actually comes from fear, I believe, because, everybody likes to tell their horrific birthing stories to each other. That has a lot of a big impact on how people think their birth is going to go. Oh, well, my sister had a horrible birth and I'm related to her biologically, and so I'm probably going to have a horrible birth. But even within families, genetics can be very different. My sister Natalie and Michelle both have the HHT, but I don't. I could have been terrified that, my births would have been horrible because of the experiences that they had. But in actuality, I probably wouldn't have ended up with the same complications because I don't have what they have. So just because someone you're related to had a horrible time, their body isn't your body. You're not giving yourself enough slack. You're also pre-dooming yourself to a bad birth. And like Kalista said, a lot of it is a mind game. Really, if you train yourself and put yourself on the right mindset and you have the correct support around you, there's no reason why anybody who is a healthy person can't have their babies at home. It's just the truth of it. Unless, of course, you have complications, like maybe if you're like an out of control diabetic or you have other complications. I really don't think people need to come to the hospital to birth their babies unless there is some kind of precondition that is necessary.
Thanks, I think that's a great perspective to have, and to have your perspective from the medical field too is super useful. Cassidy and Kalista, I know both of you talked a little bit about it, but I would love to hear both of your perspectives.
I will say one of the top questions that any of my friends ask when I tell them I've home birthed my children or that I want to home birth is like, are you afraid something bad will happen? And I just want to echo that. I feel like as you trust your body, that everything can turn out great. And I don't have much to add on like the medical side of things, but I will say I also feel like what helps me the most is to focus on what I can control though in the birthing process. And I feel like that is what steadies my mind and eases everything for me, is to focus on the little things that can control. I feel like that is the best help for me in labor. For example, focusing on your breath, focusing on the comfort measures for me, being at home. I always tell my friends when they ask me, like, is there something that you fear about being at home during labor? And I say, like, you hear people talk about water being nature's epidural. And I feel like that for me is so true. I don't think I could manage in birthing at home without water. And so that's something that I always try to focus on. Even with my last birth, with my most recent birth, my son, we had a little bit of a mishap. Like the hose wasn't working. There was a little hole. And so it was leaking. It was spraying water all through my upstairs. And so we weren't able to fill up the birthing tub in my room. And so with that, I ended up birthing in our bathtub in our bathroom, which is a lot smaller of a space. We have the toilet and the shower in a really small room. And so it was hard to fit like my support system all in that room and have people close to me. And, I really wanted to be in the water and birth in the water like I did with my daughter. But I was kind of like stretching out. I was kind of doing pigeon pose in my bathtub. And my midwife kept saying I needed to either be up out of the water or be in the water. And so ultimately I decided to stand up, and my husband was able to help me up. The pain was a little bit more intense, or the intensity of my labor. I was already in past transition at that point. But what I was able to focus on was the fact that my feet were still in the water. And that is what really grounded me. And then another thing was just being able to have those affirmations. My husband, at the exact right time, he was able to say one of the quotes that I had written on my wall over and over again. And then I was able to focus on my breathing. So I would say one of the most powerful things during birth, as far as like natural, I don't want to say interventions go, but things that can help calm, is just focusing on what you can control.
Thank you, Cassidy. I love that. I think everyone loves all the tips. Go ahead, Callie Ray.
This is so much more than a medical problem. It is a spiritual problem. And I'm going to tell you why. Because we as a society have gotten so far away from valuing the sanctity of human life. And when that is the case, you are not looking at birth as a sacred event. You are not looking at God's design for your body. And we are looking for ways that creation will fail. So what I mean by that is that I cannot tell you how many times I have had a woman call me, a friend call me, and be in so much distress because on her ultrasound, they found this complication with her baby. And I've had many friends tell me stories about this happening in the past. And on multiple of them, they have been told to abort their baby. And they choose not to abort the baby. And the baby, guess what, comes out completely fine. Those problems that this mother was so distressed about when she calls me, I tell them every time, do not pay too much attention to this. I am almost positive that you will see this resolved on your next ultrasound. And at least in these cases, every single one has been. I know that that's not everyone's story, but this is a huge percent of women who are told that there is something wrong with their baby or a deformation or there's too much liquid, too much fluid, not enough fluid, your baby's too big, all these things, and it does not come true. Ultrasounds are not reliable for the things that they are used for. And that is well established. I would also say that lifestyle has a huge impact on the outcome of both your pregnancy and what you experience and your birth and the health of your baby. This is something that is not taught in medical school. Nutrition is not something that is taught in medical school. This is not something that really your providers are going to touch on. And this is a huge reason that women experience the types of complications that they do. So I want to cover this just for a minute. I know that there are women that are going to hear this, and it is probably going to come across offensive because of their experiences, whether that be with infertility or a complication in their pregnancy and all these things. And I am going to say right now, I am not saying that those things are your fault. What I'm saying is that you have been lied to by the medical industry. You have not been taught things that should have been taught nutrition-wise to support your body and your baby. The government is failing you. The medical system is failing you because there are toxins that have been out for generations that have affected women and fertility. There are real things that are contributing to the experiences, the negative experiences that women are having when it comes to conceiving and pregnancy and birth. And with all these things that are impacting our body environmentally and in our food or the lack of food that we're eating, there is a quote unquote cure or preventative care to go with that. It is a money maker. There are doctors and nurses and they have great intentions, right? They want to be there. They want to support you. But how do you expect somebody who is in an environment where sick people go and people who are dying go to have a positive outlook on natural, successful birth? This is the problem with going to a hospital for a normal, natural birth. You are going to a place where people are sick and die. So that is going to shape the experiences that these doctors have. And, you know, this is trauma. This is trauma being passed on. The things that doctors see, the horror stories that you hear, those are real things that need to be dealt with. This is trauma that gets put on women. And that is something that needs to change because women should not have to go through this. The other thing I will say, maybe the last thing I'll say, is I can't tell you how many women have told me, you know, home birth sounds great, but thank goodness I was in the hospital because my baby came out and the cord was around their neck and I hear this and I sympathize with them, but I'm like, well, you know, that cord, it actually is pretty easy to come off. You just unwrap it. But we've been told this story that, oh no, that cord's around their neck, which, by the way, I just want to clarify, the oxygen that your baby is getting is from the placenta and umbilical cord, which 99% of the time they're still attached at that point. Important reason to delay your cord clamping, just saying. Anyway, and every birth is different. There's nothing that you can do to fully prepare yourself for the experience you're going to have. But for me personally, this is where being a woman of faith, and maybe for you, that's spirituality. Everyone's in their different places, but having something, a power above you to submit, to learn to submit to is the number one thing, because birth is something that will test your ability to let go of control. You are not meant to be in control during birth. You are meant to surrender and let this baby come. And that is a hard lesson to learn if that's not something that you are trying to do in other ways in your life. Okay, real last thought is I read this thing in a book when I was preparing to give birth. And it said, birth is as dangerous as getting in your car every day. You get in your car and you could get in an accident at any time. But do you think about that? No, most of the time you don't think about that. Why? Well, because you have to get things done. You have all these reasons. It seems to outweigh the risk of getting in the car. And yet with birth, we automatically assume that the worst is going to happen. There are things that you just cannot be in control of, but God knew what he was doing in this design, and women are strong enough to do this. And I am so grateful that we're here talking about this, because this, I really believe, is something that is changing. There is an evolution happening, a revival, so to speak, of home birth, because women are learning that they have been lied to, that they can do this, and that there is power and redemption that comes when you trust this divine process.
Thank you, Callie Ray. That was very beautiful. And thanks for all of your thoughts. It's that Sagittarius rising that you have combined with the Gemini. The preacher comes out. She comes out and she tells it. We're like, yes, sing it. Stand up. Tell us. Amen. So, thank you for sharing all of your thoughts, everybody. We deeply appreciate you. Kalista had to jump off real quick, but we were so grateful to have her and all her beautiful thoughts. I think as we're coming up to time, I just wanted to ask each of you, as we're thinking about this, about that spiritual piece in birth and how it really does affect women. How has this community, us together as a family, helped you in seeing the spiritual side of birth? I think, as Kalista said, we see it very secularly, and we forget that women are a veil. We forget that we have this beautiful power. And just how have your experiences helped empower that part of you? And any last thoughts that you have for women who want to make birth more of a sacred experience, or want to change the way that birth has happened for them? You can start, Mom.
Well, I think that this whole experience with my daughters has really opened up my eyes and testified to me more of the miracle of birth and the miracle of life itself, and knowing that we are in partnership with God as women in bringing life, procreating these beautiful babies who come to earth as their own person, with their own personalities, with their own genetic makeup. Even though they are from us, we know they come from God also. And it's been so exciting and fulfilling for me to be on the receiving end of a delivery, to be able to receive that little precious child, and to see this miracle, and to see my daughters be the empowered women that they are, and my daughter-in-law and my granddaughter. I just love how perfect the plan is that our Heavenly Father made for us. And I would say that if you will build up your relationship with your God or your higher power during your pregnancy, if you will trust in Him, as Kalista talked about, if you will surrender to His will and know and be a woman of faith, that you will be able to do whatever is best for you in your birthing plan. And if you want to be having a home birth, it is totally within you to do that. You are powerful, and your Father in heaven wants you to succeed. And I think that's all. Thanks for having me.
Yeah, thank you. Our head midwife, Bonnie Jean Dean. Thank you. Go ahead, Natalie.
Yeah, I agree with everything that has been said already. I think it's such great advice and so many great perspectives that are really important to consider and think about during pregnancy. Something I keep thinking about is how, and hopefully it's relatable regardless of your religion or spiritual feelings. It's that Eve was the mother of all living. That is what she was called. And we can all think of ourselves as if we're Eve, and we are the mother of all living. We are meant to bring life. And as Julie said before, we're meant to be this veil. We connect heaven and earth. We're that portal. If you view yourself in that holy way, I think that can really empower you to know that you are really, truly in partnership with God. You are his partner in allowing his children to come to earth. And that's incredibly humbling and empowering and beautiful and sacred. And understanding that your body and your spirit connected, your soul is the perfect design to bring these children here. It's an incredible privilege. It's an incredible responsibility. If you can have that perspective, then I think that you're able to overcome any obstacles because you know that you are doing this with your Father in heaven, that he will guide you, that he will give you those nudgings or that inspiration to know what you are meant to do, what positions you should be in, how you should move, where you should be. All of these things are going to be given to you, and you're going to have that information given to you in the exact moment. And so if we can give that knowledge to women, if we can empower them, it goes back, I think, to education. If we were giving this knowledge to women before they were women, as they are in adolescence, as they are girls growing up into these women, I think that would truly transform birth, and it would transform our culture as well. And I can see the shift that is being made, and I just hope that it keeps going. We just need to keep being advocates for women and for birth, and to let them know that they can do this, that this is what their body is made to do, that God will help them. They have everything within them already to have the birth that they desire and that they were made to have. So those are my closing thoughts on it.
Thank you, Natalie. That's beautiful. Go ahead, Em.
Wow. I love what everybody said because I totally feel all of that, and I believe that as well. Gosh, I'm having a hard time coming up with anything because I feel like everything has already been said. But I too also believe that this is a sacred calling and that we are designed to do this, and that this is actually a divine power that we have. My first birth was all medicated, the whole gamut of, put on epidural, had a little bit of Pitocin, all of that. And I felt completely disconnected from what was going on. Everybody thought it would be like a dream birth. Like I got the baby out in like 2 pushes. The doctor barely got there in time, despite being on an epidural, all of that. But I wasn't connected to the birth. And as a result, I kind of feel like that was a big factor in me having postpartum depression afterwards because something had happened to me and I wasn't able to be a part of what happened to me because I was completely numb to it, both physically and emotionally. And because I had gotten my first child out in 2 pushes, I'm like, well, there isn't any reason why I shouldn't be able to do it by myself. And that's when I had discovered hypnobirthing. Like I stumbled upon it on YouTube, and this woman had her baby, didn't scream, looked completely chill, like in transition, in the middle of the baby coming out. And I'm like, what? That's possible? You can do that? And so that's when I got into my whole study into hypnobirthing, and I was like, I'm going to do this time. So I studied and I learned all about how my mind is a powerful thing, that I have power in this process, that I don't have to view it as something painful or scary, and that it can be really beautiful. And when I had my second child in the hospital, it was like a spa day. Like I know some people think that sounds a little crazy, but I just sort of let go of this idea that it was a painful process. Did it get intense in times? Yes, of course it did, but wasn't painful. I only ever really felt like I had like a lot of pain afterwards when when the doctor would have to like stitch me up for something. That was painful. But it also was extremely empowering. Like I just had this incredible feeling of like, I'm powerful. I'm a powerful being. I'm amazing. My favorite comment I ever got from a nurse when I had one of my babies in the hospital was like, freaking unicorn. But I feel that. I feel like this process can be of mythic proportions because in actuality, at our very core, we're daughters of God, and He's given us that power, and we really need to take it back because the world has taken it from us.
That's beautiful, Emily. Thank you for sharing your experiences. I think that adds perfectly. Go ahead, Cass. I'd love to hear what you have to say.
Yeah, absolutely. I also love everything that everyone has said about spirituality and connecting to, our body and how we are truly intricately designed by God in my belief system. And I have seen how focusing on spirituality and your beliefs can really shape your birth. For me, I feel like even in preparation, thinking of affirmations, we talk a lot about affirmations and how those can help you and lead you. And I feel like for my first, I just wrote down empowering statements. But with my second, I really tried to dive into the scriptures and find things that resonated with me. And I will say that empowered me so much in my birth, and that helped me to focus on God and my divine purpose more. During my labor with my first, I was really focused on what was coming next, the next contraction. Although the labor was longer with my first, it was 7 hours. And with my second, it was a precipitous 2-hour birth. But I felt like that intensity and the speed of my labor with my second, I was able to pray more the whole time I was praying, versus the first, I was focused back on what was coming next and the contractions and what to expect. And I feel like that was so grounding for me and helped me to connect with my baby, but also to feel so much that this was what I was meant to do. This is what Heavenly Father designed our bodies for, and that He was truly there for me and could lift me up and get me through the next contraction, get me through to that bridge of being able to meet my baby and bring him earthside. And I feel like I could get emotional talking about it, but I don't think that I've ever felt the hand of God more in my life than, that moment where you get to have your baby placed in your arms. I feel like that is heaven on earth, and that the more that we focus on the spirituality of birth, the more at ease we can feel, and the more a connection we can feel to our Heavenly Father just by bringing those sweet spirits into our arms. And so, yeah, those are my thoughts. And I just think that we are divinely made. And also with this conversation, I feel like we are meant to support each other through it, and that a community is so important to our spiritual health and in motherhood and as mothers. That's all. Thanks, Julie.
Thanks so much, Cassidy. Thank you, everyone, for participating. It's beautiful to hear all of your experiences, to have everyone here at once. We've never done an interview like this, so it's so fun to have this experiment also. But I hope that people listening can get a glimpse of what it is like to have a community. And if you don't have a community, something we touched on this year's forecast was that community will be really, really important this year. So if you don't have a community and you're like thinking, well, my sisters, or I don't have sisters, or, whatever, I don't have a mom who would support me, just know that there is community out there for you. And if you start looking for it, it will come to you, and that it really can lift you up. Like, this is possible. We wanted to do this to show this is possible for you. You can find, even if it's not your sisters, you can find people who you feel akin to and who can support you in your journey with birth, with postpartum, but also just as a woman and a mother in general. And in this life, everybody needs that together. So I love hearing this, and I love hearing all of those special things that everyone said. Did you want to say something, Natalie?
Yeah, I wanted to mention that, we all live far away from each other. Julie and Emily and my mom, for a few years, have lived closer to each other. But generally speaking, when all of this started happening, we were across the country from each other mostly. And I just think you could let distance be a hindrance, or you can embrace that it's such a blessing to have technology like this, where we are able to communicate and support each other through these channels of communication, despite how far away we are in distance and proximity. So that's something that I thought would be important to bring up.
Yeah, I think that's beautiful. And you can find it, right? Like, technology makes it possible. It's possible even if you're far away from each other. All of us right now, I guess, except Emily and my mom, are in different states. So this is possible for every woman, whether or not you have kids, you're suffering with infertility, are later in your life and experiencing things with menopause and perimenopause, or just in general, like you just want to have friends. It's very, very possible for all of you. And hopefully this was inspiring to hear everybody's different experiences and that there can be changes over time. So thank you again for everyone for being with me. Thanks for listening to the interview, and we will see you next week on Feminine Alchemy. Bye, everybody.